Welcome back. Well, this morning there are some questions about the tests that newborns go through. So here to break down what each of those tests include and why they are important is Dr. Vinitha Moopen from WellSpan Family and Pediatric Medicine in Rotsville. Good morning. Thanks so much for being with us in the middle of sick season. We very much appreciate it. But, you know, when it comes to newborn testing, there is so much that happens after the baby is born, right? And especially for first-time parents who have no idea what's going on around them, when they hear that, okay, we got to do newborn testing, if you didn't know about it, it can be scary to think, like, why do you have to do this? So can you explain what is being done for newborn testing?
So for the state of Pennsylvania, the three most important ones that are done are the hearing screen, the congenital heart disease screen, and the metabolic screen. Neonatal abstinence syndrome is part of it, but it's not done on all babies.
And talk about what each screening entails.
So the hearing screen is they just put headphones on the baby and they do the screen. It's done usually after 24 hours. What we're looking for is congenital deafness or hearing loss. So the state wants them screened before 1 month, diagnosed before 3 months, and some treatment started before 6 months. So if there's an issue at birth, they usually go back to the nursery in a couple of days. If there's still an issue, then we make an appointment with an audiologist who is well-versed in newborn hearing screens, and then if there's still an issue, then we make early intervention referrals and an ENT referral as well for people who are experts in treating newborn hearing disorders.
And then, like you said, one of the other ones is the congenital heart test. What does that entail?
So that's just, they put a sensor on the baby's finger or toes, and we're checking oxygen levels. So we're checking for mainly cyanotic congenital heart disease, which is when the oxygen level is low. Sometimes those don't present in the first couple of days because of newborn circulation. So we test them at 24 hours of age or before 48 hours to make sure there's no issues before they go home.
And what's the final test?
The final test is the metabolic test, where we're checking for things like congenital errors of metabolism, where the baby's not able to break down fats, proteins, carbohydrates, congenital hyperthyroidism, where the thyroid levels are low, hemoglobin issues like sickle cell, cystic fibrosis, G6PD deficiency, a whole slew of testing. It's just done by a heel stick, and they put that on a paper, it's sent to Harrisburg, and we get results usually in about a week.
And again, these are things that you can't tell in ultrasounds, which is why, you know, when the baby comes out, there's so many questions about what's happening and what's going on around you, but these tests are very important.
Yes, they are.
Just for parents to know what's going on.
Yes, exactly. And so if there's an issue, it's best that we catch it early and we treat it early so that the side effects are less and babies are given the best possible chance at a healthy life.
And of course, if parents have any questions about what's happening, because it can be overwhelming, you know, they need to take the baby out of the room, and it may be scary for some people. So you can always ask your provider about what's going on.
Yes, talk to your nurses, talk to your doctors, and when you're discharged, talk to your pediatrician about what the test means and what the results show.
Absolutely. All right. Well, Dr. Moopen, thank you as always for informing us. And of course, if you need to go see a WellSpan facility, we have information on how you can do so on fox43.com.